research. Well, it's one of the most fascinating part of what we can do. And really, it still worries a lot of people because it is something you do at the very beginning of your life in research as a student is when you start. And one of the problems with it is that there is a whole lot of concepts, and those concepts are often so fixed that there are no do-overs. You need to do them right in the beginning. So for that, we had a lecture last week, and we have a lecture this today. Today, we are going to consider the concepts of power and effect size. Hi, and welcome to Oral Pathology 360. This is where we bring you together with everything and everyone connected to the diagnosis and management of oral diseases, whether it be oral pathology or oral medicine and oral radiology. We are very glad to have you with us. And of course, today we have the topic which really spreads across the whole span of health sciences. Researchers research, irrespective of where you're doing it. And it's really nice of you to be with us today. And again, the request is please, if you can, make a contribution. There's a super thanks and a super chat. If you click on it, you can make a contribution right away. Also, if you can't, that's also fine. Just you can like, subscribe, share, and that will all make a difference. And then, right, coming to today's talk is again by Dr. Umadevi Rao. She is very kindly accepted to do this lecture also. She's a professor of oral and maxillofacial pathology at Raga Dental College, Chennai, India. She is, of course, a recipient of multitudes of awards and fellowships. But one of the things that really stands out is she's done a lot in research and a lot in biostatistics, and that makes her very good at research planning. She's a recipient of the Fogarty Fellowship Department of Epidemiology and Biostatistics of University of Berkeley, California, USA, as a research scholar. And with that, I will bring her also with us here. Hello, Dr. Uma, welcome.
Yeah, good morning to all, and maybe good evening and good night to others in the different parts of the world. I thank you, Dr. Mandana, for bringing me in here and also for the kind words. And I'm hoping that this will be a useful session to all the viewers. Let me try my
Um,
best.
I'm definite it will be. I mean, last week's was a good indicator of how good the session is. With that, we will start with the lecture.
So, good morning to all, and I'm happy to be with Oral Pathology 360 again. Earlier, I was speaking on concepts in research, which was the part one of my presentation. And this presentation, I will give you a few more concepts and give you a summary. So, this is where we started. Let me give the brief introduction again. We draw a sample from a population. We subject that sample to some measurements, with then appropriate statistical tests are performed, and then we infer about the sample and extrapolate those results into population. So we saw the journey through the sample size and concepts, and I've introduced this title, Probiotics Reduce the Prevalence of Oral Candida in the Elderly, a randomized controlled trial. Just to summarize this title, probiotic is the variable predictor. The outcome variable is the oral candida. The population is elderly, and the design is an RCT. So we also went ahead and saw as to why we need sample size calculation, because we want an ideal sample size, not too large, not too small. And now I want you to concentrate on this conclusion of the study which I have introduced you in the beginning of my presentation. They concluded the study stating that the probiotic intervention reduced the risk of high yeast counts by 75%. Thus, probiotic bacteria can be effective in controlling the oral candida in the elderly. I used the same conclusion to explain alpha earlier. Now I'll be talking about beta and power. So all this is a part of the sample size estimation. Now, I need to again work on this results of the hypothesis test so that I can introduce beta to you. So the factors would be hypothesis, alpha, beta, power, effect size with variance. In my last presentation, I completed this concept of hypothesis and alpha. I'm going to start with beta. So this is based upon the possible results of a hypothesis test. You have the first column, your study results. In the second and the third column, what is the reality in nature? That is, there is association between the predictor and the outcome, and there's no association between the predictor and outcome. Straight away, I'm going to the third row, where I say there is a fail to reject the null hypothesis. That is, I'm accepting the null hypothesis. In my situation, the null hypothesis is probiotics do not influence the prevalence of oral candida in the elderly. Now, in the reality, that is in the God-given world also, if it is true that null hypothesis exists, that is, there's no association between the predictor and the outcome, that is, there's no association between the predictor probiotic and the outcome oral candida, then my results are correct. But in the reality, if the truth is there is an association between the predictor, my probiotic, and outcome, that is the candida, but based on my study results, if I fail to reject the null hypothesis, then I'm committing a type 2 error, and that type 2 error is called beta. Now, what is beta? The probability of making a type 2 error, that is, you fail to reject the null hypothesis when it is actually false. It's called as beta, and statisticians have derived that the quantity of 1 minus beta is called as power. So what is power? Let us look into more into it. It's a chance of finding something in your sample if it is really going on in the population. So these people said that the probiotics reduced the prevalence of oral candida by 75%. So that 75% is what they detected in their study. So their study had adequate power to detect this 75% difference between those who took probiotics and those who did not take probiotics. And normally power is usually set at 80% or 90%. And when you have more power in your study to detect the difference, then your sample size will be larger. So this is a small graph illustrating it. The greater the sample size, you're almost certain to demonstrate the significance because the power will be greater. Now, you cannot say my study had 80% power in our sample. No, we must state that we have 80% power to detect an effect size. So I'm introducing another terminology which is called as the effect size. We have 80% power to detect an effect size of a difference. For example, now you take a drug for diabetes. Maybe it will reduce the blood sugar. So you are doing a trial on two different drugs. One is capable of reducing the blood sugar, say hypothetically, 20 milligrams more than the other drug. That is the effect size which I want to detect. So at an alpha of 0.05. So your study should have adequate power to detect the difference you want to show between the two groups. So if beta is set at 0.1, then the investigator has decided that he is willing to accept a 10% chance of missing an association of a given effect size, or this represents a power of 90% chance of finding an association of that size. So this power is a very important aspect, because if you do not have the power, then you will not be able to find out what you wanted to achieve in your study. So what is the function of the power? The function of the power is to show the difference between the two groups. That difference between the two groups is called as the effect size. So you must choose the size of the association between the variables that you would like to be able to detect in the sample, or that would be clinically very important. Now, the likelihood that a study will be able to detect an association between the predictor and an outcome variable actually depends on the true magnitude of that association in the target population. So if I'm talking about probiotics and candida, in reality also the probiotic should reduce the oral candida. Then only I will be able to get the proper results for that study. So if I'm looking at a factor that is not existing in nature, then my studies also will not come appropriately. So if you have a larger effect size, that is a larger difference you want to show between the two groups, then it is easy to conduct a study. If the difference you want to show between the two groups is very small, then it is very difficult to detect in the sample. So it depends upon what is the actual magnitude of that parameter in the population. So be careful when you're choosing what variables you want to study. Now, how big an effect size do you anticipate seeing? Now, coming back to my article, probiotics reduce the prevalence of oral candida. The author started off saying that at least there should be 50% difference between the two groups, that is those who are taking probiotic and those who are not taking probiotic. Now, for example, if I am doing a study on HIV patients and I am taking two groups, those HIV patients who are on antiretroviral therapy and those who are not on antiretroviral therapy, and I want to study the prevalence of oral lesions between the two groups, especially oral candidiasis, and I'm looking at seeing an effect size of at least 30%. That is, those who are taking antiretroviral therapy should have 30% less prevalence of oral candidiasis than those who are not on HIV therapy. So that's that my effect size becomes 30%. 30% is the difference I want to show between the two groups. Now take another example. I am studying the vascular endothelial growth factor between oral squamous cell carcinoma and normal mucosa. I can begin saying I want to show at least 15% difference in the expression of the vascular endothelial growth factor between oral squamous cell carcinoma and the normal mucosa. So what is important is that effect size. You should specify the effect size, and then the study should have adequate power to demonstrate this effect size, and then you will be able to arrive at your results. This difference you must be able to show between the two groups. So it is not just the effect size that matters for continuous variables, it is also the variance. So variance is built in if variables are dichotomous. It needs to be estimated if one of the variables is continuous. So if you're choosing one continuous variable to have the effect size, you need to also know its variance. How do we do it? So let us see from the beginning now. Let us start the effect size. Where do you get the effect size from? How do you know what is the difference you want to show between the two groups? You search the literature, find out people who have done similar results, similar studies, look into their results. Based on the results, you can definitely see what is the difference they found between the two groups they were trying to study a particular variable, and use that effect size. If your study has not been done earlier, it's a new study, then you do a pilot data. That is, you do a pilot study in about say 10 or 15 patients, find out the results and estimate the effect size between the two groups. Also, you must know the feasibility and affordability when you're choosing your effect size, because I told you, if the effect size is small, it is difficult. If your effect size is large, it is easy to do. You do not have any source, no literature, you cannot do a pilot study, then arbitrarily fix it at 50%. Then you have what is called as the standardized effect size. This effect size should be divided by your standard deviation, that will be 0.5. Now, standardization is dividing the effect size by the standard deviation of the outcome variable. So this is how you should determine your effect size and the variance. It is always true that larger the standardized effect size, the smaller will be the sample size. Now, it's very important that we try to understand what are the type of variables which we are studying. So we finished, let me just summarize. In part 1 presentation, we talked about hypothesis, we talked about alpha. In the part 2 presentation, I started about beta, then explained to you that 1 minus beta is power, and I told you your study should have adequate power to show the difference between the two groups, for that is your effect size. And then I said for continuous variables, you need to also include the variance. Now, once you know what your variables are, what is your alpha, what is your beta, then you need to calculate the sample size. For that, you need to understand the type of variables, how that plays a part, I'll be explaining to you. So the types of variables determine the statistical test that will be used to analyze the data. They therefore also determine the formulae that will be used for sample size calculation. Now, all these, your sample should be drawn from a normally distributed data. That is the assumption we have. Then you know there are three types of tests. One is called the t-test, one is called the chi-square test, and one is called the correlation coefficient. T-test is normally done in a study when you want to compare a mean value between two groups. That is, you're dealing with continuous variables between two groups, then you use a t-test. If you're dealing with proportions between two groups, then you need to do a chi-square test. Suppose your predictor and outcome are continuous, then you have to do your correlation coefficient. So preliminarily, first when you have your variables, you know your predictor, you know your outcome. If both your predictor and outcome are continuous variables, you will choose a t-test to do your statistical part of your study. When you're comparing the proportions, chi-square. Now, what is the next slide going to tell us about? So, if your predictor variable is a dichotomous variable and your outcome is a dichotomous variable, then you need to do a chi-square test for calculation of your sample size. So, statistically, when you are going to analyze the data, you predetermine that you are going to do a chi-square test, and therefore, to estimate the sample size for that study, also you have to use the chi-square test formula for calculating the sample size. Now, suppose your predictor is continuous, your outcome is a dichotomous, then you still have to do a t-test. Even if one of your variable is a continuous, you will apply only the t-test. Now, suppose your predictor is also continuous, your outcome is also a continuous variable, then you will do a correlation test. So in what context I am talking to you about? You know your alpha, which is 0.05. You know that your power is going to be 80%, which is normally desirable. And you know this power is essential to find out the difference between the two groups, that is the effect size. Alpha is fixed, beta is fixed. Effect size is what you should get from the literature or your pilot data, or if you don't know, you have to fix it arbitrarily. So once you know this, you have to now look into the variables. Okay, for these variables, this is the statistical test I would like to perform when I collect all my variables, measure them, and subject them to a statistical test. So we consider three tests, namely t-test, chi-square, and correlation coefficient. So t-test we would do when we are comparing the means or the continuous variables between the two groups, chi-square for proportions, and correlation when both the predictor and the outcome are continuous variables. So if you are going to use a t-test in your study, you have to use the formula. There's a separate formula for calculating the sample size for a t-test. There's a separate formula for calculating a t-test for a sample size for a chi-square test. So that is why you need to understand what is the type of test you are doing to calculate the sample size. Now, please do not think that it's very difficult to calculate the sample size. We are talking of so much of formulas and all, but it is as simple as this, like your simple algebra. Now, if you're using the t-test, what do you have to do first? You have to first collect that formula and keep it with you. Okay, this is the formula I'm going to use for calculating the sample size for the t-test. I'm not getting into the details of formulas here because your statistician will help you. But your role would be to go and ask your statistician, this is what I want. I mean, that is the scope of my presentation now. I'm not talking of maths of biostatistics, but I'm talking of the concepts in biostatistics, which as researchers, we should be familiar and should go and request our statistician for the same. So once you know you're determining the sample size by using a t-test, as I already told you, we need to state the null hypothesis. Let me stick to null hypothesis. Then I must estimate the effect size as a difference in the mean value of the which variable? Outcome variable between the study group. So if I have a literature, I must go and see what is the effect size with respect to the outcome variable. That in my study outcome variable is candida. So the difference between the two groups. Then you estimate the variability of the outcome variable as a standard deviation. Again, the literature will give you. Then you calculate the standardized effect size, which is defined as effect size by standard deviation. Then you set your alpha and beta. So this is what you should do when you're doing a t-test. Now after this, what happens, I will tell you shortly. Now suppose you're doing a chi-square test in your study, then you have to use the chi-squared formula for calculating the sample size. So what should you do? You state the null hypothesis. Then you estimate the effect size in terms of P1, that is the proportion with outcome in one group, and P2, that is the proportion with the outcome in the second group. Then you have to calculate what is P1 minus P2, and then you have to set alpha and beta. So next, when you have the correlation coefficient, useful when both the predictor and outcome are continuous, I already told you. It examines the nature and the strength of relationship among the variables. It is a measure of strength of linear association between the two variables. For example, you can take the blood sugar level and salivary glucose level. Both are continuous variables and then they're comparable between the two groups. And always the correlation coefficient value varies between -1 and +1. Let me just detail this to you a little more. So here the correlation coefficient R ranges from -1 to +1 because when you need to apply your results, you need to understand this interpretation. When the R value is 0, the two variables do not vary together at all. That is your blood sugar and your, I'm just giving you an example, and your salivary glucose level. Now, if the value is between -1 and less than R and R is less than 1, then the two variables tend to increase or decrease together. If R is equal to 1, you have a perfect positive correlation, and R is equal to -1, you have perfect negative or inverse correlation. So what should you do now? When you're estimating your sample size using the correlation coefficient test, you need to state the null hypothesis and decide whether you have alternative hypothesis as one-sided or two-sided like other tests. But as I told you earlier, let us now stick to null hypothesis because alternative hypothesis will demand my explaining you a little more on the normal distribution curve. Then you have you estimate the effect size as absolute value of the smallest correlation coefficient that is likely to be detected. That is, you have to know what is your R value, and then you set your alpha and beta. Now calculating the sample size. Whether you're using a t-test or whether you are using a chi-square test or whether you are using a correlation coefficient test, all that you have to do is you have certain softwares which will help you. I will show you them very shortly. So always the alpha is fixed because you want a statistical significance of 0.05. You would keep it at 0.01 if you are doing very sensitive drug trials. You want lower statistical significance. But otherwise, alpha is fixed, beta is fixed. You know it is 80%. Effect size is the one which you want to demonstrate. The clinical difference you want to show between the three groups. So if three are specified, then the fourth one is determined. That is your sample size. So it's very simple. It's a simple algebra like calculations here. You have your alpha, you have your beta, you have your effect size. You just incorporate the necessary numbers either in the software or in your formulas. Then the fourth one, that is your sample size, is determined. Now please remember that sample size estimation is something you should do at the beginning of your study. It is never the last thing to do. I'm sure you'll agree with me now why. Because we have so many issues when we are doing our studies: type 1 error, type 2 error, adequate power, we should not miss an association. So all these factors, all these parameters can be factored into the calculation of your sample size. Because if you do not have adequate power to show the difference between whatever you want to show between the two groups, then there's no use of doing any study. Adequate power is essential. You can also do multicentric studies and gain the power also. Okay, in question of a small research study, I can understand if there's no adequate power, but when you want to extrapolate your results, you must have adequate power to show the difference, whatever you want to show, at an alpha of 0.05. Now, these are some online resources where you can log in and do the calculation of your sample size. All these are available today. You just have to look out for them. These are the other sources. I'm not getting into details because they're all available on the internet today. And then I'm coming to this part of the presentation. Suppose you're not using the software, and if you are using formulas for doing it, then you have to substitute these numbers in the Zekrit value. So if you are, now let me just come to this. Yes, if you have, sorry, the previous slide again. If your significance criterion is 0.05, then the Zekrit value is 1.96. That is what we normally do, right? We want a 5% significance, or 0.05 is the alpha value. So in your formula, when you want 0.05 as your alpha, you need to substitute 1.96. Similarly, in your formula, if you want a power of 80%, that is your significance criterion is 0.8, then the Zekrit value which you have to substitute in the formula is 0.842. Now, after calculating a sample size, if you get a large sample size, there is a scope for a statistical manipulation which is acceptable. You can use a larger alpha, or you can reduce your power from 90% to 80%. Again, I told you variables are very important in calculation of your sample size because that determines which formula you're going to use for the calculations. So instead of using a dichotomous outcome, you can use a continuous outcome, or you can use a more common outcome. For example, for submucous fibrosis, you can have burning sensation and you can have mouth opening. Maybe you can use mouth opening because that's a more common outcome with respect to the disease. So we can take the statistician's help to see if we can reduce the sample size, but at the same time should have adequate power to show the difference between the two groups. That is to keep up with your effect size, which you want to demonstrate between the two groups. Now, one issue is whenever we're doing a study is the dropouts. So we want to follow up the patients, especially in a prospective study. So we do account for this dropouts in our sample size calculation. Normally, 20% of the sample will be lost to follow-up. That is an assumption. Then the sample size should be increased by a factor which can be calculated, that is 1.25. So depending upon how much percentage of follow-up you are expecting to be lost, accordingly you can calculate the dropouts, but do account for the dropouts when you are calculating the sample size. So I think I started my presentation with the example, probiotics reduce the prevalence of oral candida in the elderly patients, a study that has been done in the United Kingdom and which was published in the Journal of Dental Research. And using these examples, I made an attempt to explain the concepts of what is a research question, what is a hypothesis, what is alpha, what is beta, what is power, and then how you would calculate your sample size with respect to understanding the variables. Now, I'm concluding my study with an article published in the Orthodontic Journal, Bonded versus Banded First Molar Attachments, a randomized controlled clinical trial. Again here, your variables are already there, bonded versus banded first molar, and what they found the difference between the two. Now, this article strictly compiles with all the concepts in research. I mean, that is the reason I chose this article. Now, the objective of the article was to compare the clinical failure rates of bonded first molar tubes with those of cemented bands during fixed appliance therapy. And then it was a prospective randomized controlled clinical trial, again done in UK. Now, what did they conclude in their study? They concluded that the first molar tubes bonded with Rely A bond composite showed a significantly higher first-time failure rate than the bands which are cemented with intact GIC. See, this is an article where they're talking of two different materials. They're promoting one material saying that it is good, and they're also telling what is the problem with the other material. So, I mean, it needs a lot of authentication to say that something is more preferred than the other material. And see how meticulously they have presented this article. Even in the material and methods and section, they have given so much of importance for the sample size calculation, because they know and they want to prove that their study had adequate power to show the difference between the two groups, and also that they need to convince others results that their results are true, and even if there was a type 1 error, it is less than the predetermined chance they have given themselves. That's why in the sample size calculation they have written to give, what did they say? The sample size for each group was estimated by the number of the first molar attachments required, as this was the unit of measurement. The study was based on demonstrating a 15% difference, that is the effect size they are talking about, between the two groups in the first time molar attachment failure rates between the two groups, which was thought to be clinically significant. That's why they chose the 15% as the effect size. To give 80% power and a 5% significance level using a two-sided continuity corrected chi-square test. So they knew they're going to do the chi-square test in the study, and therefore they used the chi-square formula. Then what did they do in the discussion? In the discussion also they are stating the main finding of the study was that the failure rate of bonded molar tubes was significantly higher than that seen for bands, and the survival time of the bonded tubes was almost half that of the bands. So this finding resulted in rejection of the null hypothesis. So they're very, very clear as they rejected the null hypothesis that there is no difference, and then they proved that the GIC banded ones are better than the composite ones, which had the first time failure rate. At the same time, and where they're talking of the study design, they explain the limitation of this. That is, while the study doesn't achieve the required sample size, the original sample size calculations did not take into account aggregation of attachments within the participants. This uses of clusters reduces the power of the trial, and multiple testing increases the chance of false positive results. So an increase in sample size is required if you are going beyond the objective of which the study was done. So they conclude saying, fortunately in this study, the number of participants recruited generously exceeded the initial target. I mean, this is a fantastic article to understand the concepts in research which I have just detailed to you all. Now, one point about this. Now, normally we say that we could not reject the null hypothesis. That is, the statistical procedures lacked the power to detect the effect because the sample size was too small, even though the treatment had an effect. The treatment is expected to have an effect, but your results won't come that way. That's because your study did not have adequate power to show the difference what you wanted to show. So from where you could have had the power? You can have the power only if you have the adequate sample size. Thus, considerations of the power of a test permits us to compute the sample size needed to detect the treatment effect of given size that we believe is present. So most of the times, but not necessarily always, not significant means maybe you did not have adequate power. But even if with adequate power, if it is not significant, that means that is the result which you have to accept it. Now, let me summarize this again here. In this part of the presentation, I would like to tell you an attribute for power of a study. It gives the feasibility of research design, which one? The sample size. So it's an important attribute for power. And it also tells you the scope of the variables that can be included in your study. So its determination for research projects is an essential part of a study protocol for submission to ethical committees. So when you are going to conduct your study and you're standing in front of your IRB or IEC, you need to have the sample size calculation done. When you are submitting your proposals for funding, you need to have a sample size calculation done. And when you are sending it to peer-reviewed journals, absolutely, if you want it to be published in a good journal, you need to have the sample size calculation. Sometimes, even if you do not give the details of your sample size calculation of your alpha and power, based upon your result, they will calculate your power and then they may reject it if you do not have adequate power. So that, as I told you, it has only 4 parameters: alpha, beta, effect size and sample size. If you know one, you can calculate the other. So even if you have not mentioned the power will be calculated. And if your study does not have adequate power, there is a chance that the results may not be accepted. So now again, summarizing the second part of my presentation, along with the first part, the most important thing you do in your research is your research question. You need to have a hypothesis. You need to list out the variables. You should use an appropriate statistical test to draw inferences. And then all this can be done with incorporation of alpha, beta, power, and effect size in your calculation of your sample size. And your study should have adequate power to show the difference you want to show between the 2 groups. And then your study results will be extrapolated to the population from which you have drawn the sample. So I conclude saying that getting right answer to your study is you should have adequate sample size. Thank you for being with me now. I thank my management, Ragas Dental College and Hospital from Chennai, my mentor, Dr. John Greenspan, and teachers at California, and all my colleagues and postgraduates at Ragas Dental College were always there with me. Thank you.
That was very, very interesting. Thank you for that. Now let's open it for questions and discussions. As usual, please type your questions, your comments, your thoughts in the chat, and we will get to them. In the meanwhile, okay, something has come from Dr. Shruti. Let's see what that is. Dr. Shruti says, you have shifted the paradigm of manuscript reading from simply going through just the objectives and results to noticing certain nuances in the methodology section. I'm proud to be a student. Yes, that was really very clear and nice. That is very true. So, till everyone gets their questions organized, there's this part. Sometimes when we think about sample size, and if what we are doing, there are too few, so it becomes a problem. But from what I remember, there is a way to adjust that. Is although the best is to have an equal sized study sample and controls, but if one is not possible, we can always increase the other one within limits. I think the maximum being that I think 3 times is the limit. Beyond 3 times, it becomes rather wasteful. So, what do you think of that? This is something that I think most often people don't realize, that they can say, for example, increase uh, their control. Or, in fact, I think in histopathology, where sometimes for us getting the normal is more difficult, we can maybe increase the sample size and keep the control small and still get a good power.
Yeah, basically that's what's called a statistical manipulation. So we can that is where we can utilize these factors, like you can reduce the alpha, or from 0.05 you can make it 0.01, and then maybe depending on the question you're trying to answer, you can bring the power from 80% to 70%. And then you also, when you're doing a follow-up study, take care of the control group also. So maybe initially you don't have to recruit them, that increase sample size. In the latter part of the study, if you're not able to get the follow-up, then you can increase it. So this statistical manipulation, I think you will definitely, a biostatistician will be able to help you. And for example, I told you the variables are very important when we are trying to estimate the sample size. So if we use a continuous variable than a dichotomous variable as a primary variable to answer your research question, so that will also reduce the sample size. That I can give you an example in submucous fibrosis. Even burning sensation is a variable, but mouth opening is also a variable. But if you use mouth opening for calculation of the sample size, and then the number will definitely be reduced with a good efficacy of the study too. So I think the biostatistician, we should be able to tell the biostatistician what we want. We should take the, we should convey the information, and tell, this is what I want. Can you help me on this? And I think it is possible.
Yes, that is very important, because sometimes I feel there we fail. That's where we fail, because there's no clarity on our end exactly because once we have an understanding of what all of these things are, then we can tell the biostatistician what are the particulars of our study. Like, if in our study we find that we are going to have a problem with the number of cases, or we're going to have a problem with the number of controls, or that the variables are difficult to judge, or the size, or the expected size of the effect size is really going to be small. These are things which we know of the study. The biostatistician does not know this. And this
Yes.
is where the interaction is very important.
Yes,
Yes.
I think I would again emphasize that interaction is very important, because
Yes.
we are
Like everywhere
we
else.
have a different education. Like we are into pathology or any other branch you have chosen in science, and the communication is there. I think the results will be very, very extrapolated. Yeah.
Yes, and also I think I don't know your experience, from what I have noticed, we are very well educated about the alpha error. We are very well educated about the significance test. We are not so well educated about the beta. For some reason, we seem to be focused on the alpha. I mean, like, people will not even think of the power and the beta. It's something I've always noticed. Even our articles tend to show that, actually.
Actually, the power is very important, because even if we don't mention the power, when we are sending it to international publications, they will calculate the power, because when you have alpha sample size, they will definitely calculate the power. And if you don't have the adequate power to show the difference you want to show between the two groups, so that effect size, you should have the adequate power to show the effect size. Only then your results can be extrapolated. That's why I was trying to highlight with the examples of the orthodontic study and the probiotic study. Very well structured study working around the effect size and the power. So we did have experiences when manuscripts would be sent back saying you didn't have adequate power. So might as well look at that aspect when we are designing the study itself. If I have
Yes.
got that point through, I think I'm happy.
Yes, I think also PAR is a little more complicated compared to our just the alpha error, because the PAR is a product of four variables, and that makes it by default more complex. So it is, but it's a very interesting, and you put it forward very well, and I also hope now people will begin to pay more attention. I think now the only thing that is left to cover another time would be the confidence intervals.
Yeah,
That would be another time.
I'll be, I'll be glad to do it in case you want me to do it.
Yes, yes, definitely. because that will then wrap it up, like we will have covered all. And no, we don't have any more questions as yet. I think everyone is in a slightly holiday mood.
Yeah.
Most are logged in from home. Yes.
So my
And
best wishes and a very happy Vijay Dasmi and Dasara to all who have been watching and who are going to watch, or have a great festive season. I think it is followed by Diwali. I think the tag should
yes,
be there.
right. This side we have just finished celebrating, Ganesh festival,
Yeah.
and then we have moved on to Dasera, and then we will move on to Diwali. Yes, celebration time, big time. So, okay, we have another comment from Dr. Pratyush who says, wonderful session. Thank you for making the concept so clear. That is true. And Dr. Okay, I am a little worried about attempting that name, and I hope I will not mess it too much, but I'm just going to say Dr. Faluso. Okay. And well done, Dr. Uma, ma'am, for clarifying the basic concepts. That is very nice. Yes. And earlier on, we had Dr. Nandini, who I think is attending after a very long time because this time is coinciding with her lecture time. So she was here very enjoying your lecture. And we have Dr. Matthew Jacob. Excellent presentation, ma'am. Even undergraduate students will find it simple and straightforward, especially for UG students preparing reports for ICMR. Yes, absolutely. Also with us, we have today Dr. Dinkar, Dr. Divya, and Dr. Osmani Guevara, who joined us from Ecuador. And yes, that is all that we have so far. In fact, Dr. Umar, if possible, if you send me those details of all the two studies you showed and all those links which you shared, because then if I put them in the description, there will be clickable links that anybody can go
Yeah.
to, and that
I
will
will.
make it easy.
Yeah.
Right. Okay, I think we are generally done, and so
I can
let's
share the
just
manuscripts link and
yes,
websites link. They were
yes, ma'am.
actually, they were provided to me, and I experimented on them. But I told you, as in my earlier session, Mrs. Hema, my biostatistician, she's
Okay.
the power behind me. So
Wow.
I would,
Yes.
yeah, I could definitely share those links with you.
Yeah, because that makes it easy for everyone to just visit and have a look.
The
Right.
manuscripts are pretty, it's maybe published much earlier, but I think the concepts are never going to change.
No, they're
So
not. And
this is
I also accept they were very well written. I mean, from what I could see, especially the one you discussed at length for the whole the probiotic one, very well written. It's true. Yes.
thank you.
Yes, Dr. Divya, thank you for being with us. So let us share your certificate.
Thank you.
Thank you so much for the second lecture. It was definitely very interesting. And like you suggested, we will expect you back after getting a little break for the next part. I mean, now that I've found you, I'm not going to let you go very easily. So,
See, it's a pleasure, Mandana. If I can, by God's grace, if I can deliver something, I'll be happy.
yes, you do a great job. Thank you so much. So, now let's move on with what is going to be our next week. So, next week we are presenting a recorded lecture from the proceedings of the international conference which we had, and that is going to be all about WHO 2022 and the classification of odontogenic tumors, sorry, cyst tumors and allied lesions, and what has changed and what is controversial. This was a very interesting lecture that was given by Professor John Wright during the conference, and I felt that we should share it with the rest of our audience. And of course, you know the classification is new and the book is new and it's going to be with us for some time, so best everyone gets updated with that. So that's what we're going to be sharing with you next week, and that's a well regular time. And With that, I am going to say that after today's talk, all I can say is that may you always have the right power in your studies and in your research, and all your research will hopefully be very successful. We look forward to having you back here soon, next week, in fact. And in the meanwhile, thank you so much for being with us. See you next week.